Amyloidosis is a systemic disease caused by the deposition of misfolded protein fibrils, which can accumulate in various organs including the heart. When these amyloid fibrils deposit in the myocardium, they lead to cardiac amyloidosis (CA), condition that can result in restrictive cardiomyopathy and eventually heart failure. Interestingly, one of the earliest warning signs of systemic amyloidosis is carpal tunnel syndrome (CTS). Studies have shown that up to 50% of patients with transthyretin amyloidosis experience CTS, often years before any cardiac symptoms appear. This means that CTS can serve as a red flag, signaling the potential for future heart involvement. Recognizing this connection is crucial, as early detection of cardiac amyloidosis can significantly improve patient outcomes by enabling timely intervention before the onset of severe heart dysfunction. Cardiac diffusion tensor imaging, or CDTI, is an advanced non-invasive imaging technique that analyzes the microstructure of the heart muscle. Unlike traditional diagnostic methods, which may require invasive biopsies or expose patients to radiation, CDTI uses MRI technology to map how water molecules move within the heart tissue. Two key parameters measured by CDTI are mean diffusivity (MD) and fractional anisotropy (Fa). MD reflects how freely water can move, while Fa measures the directionality of that movement. In amyloidosis, amyloid deposits increase MD and decrease Fa, indicating microstructural changes in the heart. This study applied CDTI to patients with CTS who had confirmed amyloid in their wrist tissue, as well as to patients with established cardiac amyloidosis, hypertrophic cardiomyopathy, and healthy controls. By comparing these groups, researchers aimed to determine if CDTI could detect early signs of cardiac involvement before traditional symptoms or test results appear. Results of the study were striking. Patients with cardiac amyloidosis showed the highest mean diffusivity and the lowest fractional anisotropy, reflecting significant microstructural disruption in the heart. Importantly, patients with carpal tunnel syndrome and confirmed amyloid deposits, who had no clinical signs of heart disease, already exhibited intermediate changes in these parameters. Their MD and Fa values were distinct from healthy controls and trended toward those seen in cardiac amyloidosis. This suggests that CDTI can pick up subtle heart changes well before traditional diagnostic tools like pyrophosphate scans or biopsies would indicate disease. Earlier detection means earlier treatment, which is vital since therapies for cardiac amyloidosis such as tafamidis are most effective when started early. CDTI's non-invasive nature and sensitivity to microstructural changes make it a promising screening tool for at-risk patients, potentially transforming how we approach early cardiac amyloidosis. This research highlights the potential of CDTI as a game-changer in the early detection of cardiac amyloidosis, especially in patients with carpal tunnel syndrome who are at increased risk. By identifying microstructural heart changes before symptoms or standard tests reveal disease, CDTI could enable clinicians to start treatment sooner, improving long-term outcomes. Study also underscores the importance of recognizing carpal tunnel syndrome as more than just a nerve issue. It can be an early warning sign of a much more serious systemic condition. While further validation and larger studies are needed, CDTI's non-invasive, radiation-free approach offers a safer and more accessible option for screening. As research continues, CDTI may become a standard part of evaluating patients with CTS or other risk factors for amyloidosis, paving the way for earlier, more effective care.